Today I come to ask you for your support in helping to convince our state legislative body to legalize marijuana in South Carolina for medical purposes. According to Meg Kennard of the Associated Press, South Carolina lawmakers took a step closer on Thursday, March 28, 2018, to become the newest state to allow legalization of marijuana for medical purposes. On an 8-6 vote, the Senate Medical Affairs Committee approved a measure that would allow the use of medical marijuana to treat some patients. It will now go to the full Senate. But bill sponsor Tom Davis said he knows it won't get ultimate approval this legislative year, which ends in May. But there are high hopes for 2019. Dr. Peter Grinspoon of Harvard Medical School explains that there are two types of marijuana, which are called cannabis or cannabidiol. Cannabidiol is the extract from the hemp plant and is known as CBD. Because this component of marijuana has little, if any, intoxicating properties, it is sometimes the preferred choice for doctors because it does not get patients high and it is the least controversial form. Patients do report many benefits from CBD, such as relief of insomnia, anxiety, spasticity, and pain, as well as success in treating potentially life-threatening conditions such as epilepsy. Cannabis is the most commonly used form of medical marijuana in the United States. Marijuana is clearly a safer option than opioids. Marijuana appears to ease the pain of MS and nerve pain in general. It can be a great muscle relaxant and can lessen tremors of those who have Parkinson's disease. It has been used quite successfully for fibromyalgia, endometriosis, and many other conditions where the final common pathway is chronic pain. A very promising area of research is its use for PTSD in veterans who are returning from combat zones. Medical marijuana is also reported to help patients suffering from pain and wasting syndrome associated with HIV, as well as irritable bowel syndrome and Crohn's disease. I moved to South Carolina from Illinois, who legalized marijuana for medical purposes in 2013. The results that I have witnessed for family members and friends, the results I have seen for a family member that has had severe Crohn's disease for 20 years are remarkable. Dana has had to wear a colostomy bag for over 6 years after constant failure with medications and surgeries on her intestines and surgeries. She was in constant pain and hurt all the time. She has been using medical marijuana for just under 2 years, and the difference in how she feels and looks is amazing. She was not very enthusiastic about attempting this course of treatment, but is in such a better place physically and emotionally because of it. I also have a friend, Debbie, who is battling cancer. Following chemo and radiation, she was weak, tired, and down to under 100 pounds. She, too, started medical marijuana reluctantly. The way that it has helped her in controlling her nausea and joint pain has allowed her to gain weight, get stronger, and return to some type of normal lifestyle. There are currently 29 states and Washington, D.C. that have some form of state legislation, but the use of marijuana is still considered a federal crime. It is important to note that each state has its own set of rules. According to marijuana doctors, patients looking to qualify for medical marijuana in the state of South Carolina have to be a resident of the state and provide proof. They must also be able to obtain their medical records indicating their past medical history that they have been diagnosed with a qualifying condition as outlined by the state of South Carolina. The patients must also be able to obtain a written prescription from a doctor who is licensed in the state of South Carolina, solidifying that the patients are qualified and will find relief from cannabis. They must also apply for and receive a medical marijuana card from the state of South Carolina. The Compassionate Care Act, when passed, will provide treatment guidelines by specifying a list of conditions for which medical marijuana can be used. According to Marijuana Policy Project, their suggestions are that each one of us do the following 3 things to help get these reforms passed. If you live in South Carolina, please email your lawmakers in support of a compassionate, comprehensive medical marijuana legislation. Ask your legislators to support common sense penalties for marijuana possession. And also urge your lawmakers to end marijuana probation and replace it with a system to tax and regulate marijuana in South Carolina. Hopefully, South Carolina lawmakers realize that it's time to reform the state laws regarding the use of cannabis for medical purposes.